The concept of cord clamping is a very important one, but also a very old one. It's as old as life itself. What is interesting is that over the last 100 years or so, there's been this increasing movement of trying to clamp the cord sooner. And in the process, I think we've unfortunately gotten away from normal physiology. As currently, as people are now talking about delayed cord clamping, even this is not necessarily correct, because it's actually what our focus should be on is on physiologic cord clamping. What is the normal transition from fetal to neonatal life, rather than what does the clock say? 30 seconds, 60 seconds, 90 seconds. The main question is, what is the physiology telling us? And what it tells us is that when the fetus transitions to a neonate, they must first breathe, then the placental circuit can be removed. It is the breathing that is the most important thing. And this is the thing that is unfortunately absent with current management of deliveries. The cord is clamped either right away or after a certain clock time has passed, without paying attention to whether the baby is breathing first. Because without breathing, you don't establish pulmonary blood flow. Without pulmonary blood flow, you cannot establish good cardiac output at the moment the cord is clamped. The latest developments in our knowledge, our understanding of physiologic cord clamping is done largely by the research of Stuart Hooper. And the amazing thing about this research is that it's giving us a lot of insight into the transition of the pulmonary blood flow, causing the left ventricular preload at the time of the cord being clamped. The funny thing is that the research that's now being shown is actually something that has been observed for hundreds of years by people who have been watching normal transition of babies at the time of birth. And so, in a sense, even though it's new research, it's just rediscovering old information. And indeed, all of physiology is actually discovering and rediscovering what is already occurring. We just have to be open to it. The biggest challenge sometimes in life is change, even though change is always inevitable. And so when it comes to changing the way that we manage birth and the way that we talk about cord clamping, the biggest challenge to changing the current practice of clamping either immediately or after the clock tells us something is to remind people that it's actually not the clamping that's important, it's the physiology. And the physiology being that once the baby takes its first few breaths, that's when the transition starts, not the cord clamp. The cord clamp does not symbolize transition, because even though you clamp the cord, the baby still has a fetal circulation. So you clamp the cord and nothing magical happens. If anything, you actually now are harming the transition. Normal transition, normal physiology is baby breathes, and even if that means we have to provide assisted ventilation, then that's what we need to do, and that will trigger the transition process. Then we can clamp the cord. This is, even though it's physiology, it will be very difficult, I think, to change current practice, because now we talk about you must clamp the cord rather than what is happening to the baby. This Congress, I think, is extremely important for so many reasons, because in the end, no matter what challenges we have in life, especially when it comes to healthcare, we're talking about improving the lives and saving the lives of babies and children in this part of the world and indeed the whole world by our profession. And just like any challenge in life, one of the key things is communication and listening. And having this Congress, it gives people the opportunity to come together, to be able to communicate, to be able to share their knowledge and their experiences, and also to listen to each other. And as this occurs, I think we'll find out that not only do we have a lot of things in common, but also it's through the communicating and listening to each other that we'll be able to, I think, as a group of healthcare professionals, really improve the care of babies and children, especially here in the Gulf. So the Congress is an amazing collection of people, not only from people who are participating in the Congress locally in the countries surrounding the Gulf region, but also bringing together speakers and experts from all over the world. And indeed, it shows that what happens in one part of the world is not that different than what happens in another part of the world. That we're all in this common goal together to improve the way that we're able to help babies and children, especially during the most critical times in their life when they're sick. And without congresses like this, people would not be able to meet and to come together. We would just be talking by emails and reading articles instead of actually talking with each other, getting to know each other. And like I mentioned before, I mean, just finding the commonalities of the community of physicians, nurses, social workers, respiratory therapists, allied health professionals, pharmacists coming together. And this is really the only way that the ability to take care of babies and children will really increase. We have to create the culture and the community. It's not going to happen quickly, and it will not happen easily, but this is how it happens, by coming together. And this Congress, I think, does that very well.